Thank you very much. It's a great pleasure for me to be here. The relationship between art and science, to me, is something to be viewed pragmatically. We are all putting questions. We are searching for at least preliminary answers, and we should certainly talk to each other. As a neurologist, my question is, what are the diseases my patient is suffering from, and I'd like to reduce the suffering of my patients. In my presentation, I will be talking about memory and the biological basis of memory disorders and dementia. You may wonder where our thoughts are stored in our brains. It's a discussion that goes back a long way in history. We have two major hypotheses, groups of hypotheses. One is the holistic hypothesis that says that memory is everywhere in our brain and beyond our brain, possibly in the body, as Mr. Haynes already suggested. So it can't be localized. The other hypothesis is thoughts are localized and can be identified in a circumscribed manner. Which arguments speak in favor of one or the other? From the neurological point of view, there have been a number of experiments made by Carl Lashley last century, who experimented with rats. He trained rats to perform a certain task, and then he removed parts of the brain of those rats, trying to find something that makes memory disappear. He couldn't find anything. What he did find, though, was the more of the brain he removed, the less able were the rats to perform their tasks. But he didn't find a circumscribed location. So his conclusion was that the content of memory is not localized, but spread out over the brain. A patient and his sad history led to considerable advances in brain research. There is an argument in favor of holism also in brain research, because after brain surgery, patients hardly ever say that they've forgotten this or that, anything specific. But now the patient, H.M., meanwhile, we know his name, Henry Gustav Molaison, who died in 2008. He suffered from severe epilepsy, and his physician, a neurosurgeon, decided to perform a heroic operation. He removed large parts of the temporal lobe on both sides of the brain. In particular, he removed the hippocampus. Now, what you can see here is the hippocampus, a structure deep in the brain, the blue structure. It has got, it's called hippocampus because of its shape. Now, what is this all about? This is H.M.'s brain after the surgery. Large parts of the deep structure of the hippocampus have been removed. If you want to know more about this part, this particular brain, you can find a detailed description on the internet. After surgery, H.M. suffered from a severe memory deficit. What had happened? He was not able to remember any new events. For anything new, his memory had disappeared completely. But he was still able to remember things that had happened in the past. And the more remote the past, the better, the more intact the memory. And through the experiments made with him, we learned more about the hippocampus. The hippocampus is relevant for learning something new. But after some time, you can recall things even without the hippocampus. Now, what is the role of the hippocampus as we see it today? An experience consists of many components that are stored in different parts of the brain. Visual impressions, auditory impressions, tactile impressions, emotions, words, spread out, distributed over the brain. The hippocampus is a kind of connector for these impressions. The impressions are connected in a certain sequence and stored in connection with the individual brain areas. And this is a process which only the hippocampus can do. Without the hippocampus, this trace of memory cannot be generated. Over time, however, these areas connect directly. And this connection is getting stronger and stronger through sleep. Sleep is very important, and after some time, the hippocampus is no longer needed, and without that catalyst, memories can be called up. It's like an orchestra and a conductor. The conductor has got the score, the musicians play, they are communicating with each other, and after some time they don't need the conductor anymore. Now, what has that got to do with dementia? This operation, this surgery was performed once and never again, given the outcome. But more and more people are suffering from symptoms quite similar to those of HM, a memory disorder, that is dementia. This diagram shows the age dependence of dementia. As you can see, with increasing age, the prevalence of dementia increases. In the group of over 85-year-olds, more than a quarter are concerned, over 90, more than 35%. And given the demographic development, we have to expect a growing number of people suffering from dementia. Now, what is dementia? Dementia is a global reduction of mental performance in a subject that was healthy before, and to an extent that goes beyond the normal process of aging. There are many causes, and the most important one is Alzheimer's disease. Described for the first time by Alois Alzheimer at the beginning of last century. In a patient, he found plaques. He found these structures, which have been named Alzheimer plaques. They're also called amyloid plaques because this is the protein which is deposited there. What's the effect of these plaques? The deposits that occur for a reason we still fail to understand, cause damage in neighboring brain cells. Brain cells and their connections die gradually wherever such plaques occur. And they have a preferred location where such plaques can be found in an early stage. It's in the very structure that was removed through surgery in HM, that is the hippocampus. Two brains, a healthy brain and the brain of an Alzheimer patient. On the left, you can see the hippocampus. On the right, all there is left is a hole. The hippocampus has almost disappeared as Alzheimer's disease progresses. This is the symptom, the first symptom in most people, forgetfulness. We all are forgetful, and young or old, we ask ourselves, is that a first symptom of Alzheimer's disease? You can, of course, have the slides if you're interested. Here are some indications of what is normal and what could be an indication, an early symptom of Alzheimer's disease. Can't find your keys, that is no symptom. But if you put your keys into the fridge or your purse into the dishwasher, that is a serious symptom. If you can't remember names, well, I would have diagnosed Alzheimer a long time ago in myself. But if I can't remember my wife's name, if I can't remember the names of good friends of mine or of everyday things, then it's a serious cause for concern. These are differentiations which are not 100%, but nevertheless rather clear indications. Now, how does Alzheimer's progress? In the early stage, it's small things, frequent recent memory loss, mild coordination problems, and an early symptom, emotional symptoms. Depression in many patients is an early symptom of Alzheimer's. In a moderate to middle stage, the symptoms can no longer be covered up. Activities of daily living can no longer be performed, and changes in mood occur. Depression may get much more severe. A rapid fluctuation of ups and downs. And finally, in the severe stage, after 10 to 15 years, verbal communication is no longer possible. Independent living is no longer possible, and there are many physiological problems of daily living and severe mental problems. Is there a treatment for Alzheimer's? Unfortunately, there is no real cure for Alzheimer's. There are many drugs available in the market, but all they can do is cure some of the symptoms. In some people, mental performance can be, or memory performance can be improved slightly, but not much. So you may wonder, is it worthwhile seeing a physician if you can't do anything at all? A neurologist comes up with highly complex images and diagnosis, but in the end he will tell you, no, I can't do anything for you. Well, an important reason in favor of seeing a physician and having a diagnosis is that Alzheimer's disease is not the only form of dementia. Many people suffer from similar symptoms, and that can be treated. Thyroid diseases that can be cured through thyroid hormones produce similar symptoms, or too much water in the brain can also be treated. And there are depressive disorders that are not a manifestation of Alzheimer's and that can be treated effectively. And if these diseases, if these treatments, if these symptoms are treated, the apparent Alzheimer's symptoms will also disappear. So detailed diagnosis is absolutely necessary. Is there any hope? Where do we stand today in our research efforts? Could there be a treatment in the future? I think the biggest hope, which is shared by many in research, is a hope for a vaccination. Animal experiments are quite promising. Trials have also been made in humans. It's the idea of injecting antibodies against the plaques, and we know that they can remove the plaques. So vaccination works, but the problem in the first trials, in the first studies, was that there were severe side effects, and another problem is that if treatment only starts when the symptoms have occurred, nerve cells have already died. So we would have to start long before the disease breaks out. We take it that the plaques start depositing in the brain 20 or 30 years before the disease breaks out. So if you start vaccinating someone so early, you have to be really sure that there are no undesirable, no adverse effects. Prevention, is there anything we can do in terms of prevention here and now? Yes, we can do something. There are measures that have been proven to work. Be active, exercise, engage in sports, engage in intellectual activities, learn a language, read a lot, go to Ars Electronica, go out with friends in the evening, go out dancing. Dancing appears to promote the plasticity of the brain, and there is the social aspect on top of it. And if occasionally or regularly you see your physician, and if you avoid or have two risk factors treated, that is high blood pressure, and if you keep your weight down, then you have already done a lot, at least to delay the outbreak of dementia. Thank you very much for your attention.